Here at Fountain Valley Regional Hospital with CEO Kenneth McFarland and Denise Flaws, Director of Emergency Department, and Amy Lewis, who you'll meet soon. She's the manager of Emergency Department on their operations and recently received an ENA Lantern Award. We're going to hear about that. It recognizes emergency departments that demonstrate exceptional and innovative performance in leadership, practice, education, advocacy, and research. It's definitely a prestige award for a Fountain Valley business. Because we are social distancing here, I'm going to remove my mask for the rest of this program. And I will ask Ken, start with thank you for taking some time out of what I know is a busy schedule these days and share some updates about Fountain Valley Regional Hospital for our community.
Thank you for asking, Mayor, and likewise, given our distancing, I'll take off my mask. It's hard to believe for me personally to think that on March 4th, our governor issued a state of emergency. And then on March 19th, the governor issued a second letter that pretty much shut down the state. And that seems like a million years ago to where we are today, 5 months in the rearview mirror. And I'm thankful, and I count it as a blessing that we're doing as well as we are, given the circumstances. And for those who don't really know, Fountain Valley Hospital is what I'd call a jewel in the crown of Fountain Valley. We have this beautiful facility, 400 beds. Believe it or not, 2,200 employees call this place home day in and day out, and over 800 physicians that practice medicine here. We're very busy, and what's really exciting in the light of a pandemic is we're about to enter into our Jubilee year. So Fountain Valley Regional has been a treasure to the community since September of 1971. Lights are on, the air is flowing, and we're making people well. Denise and Amy saw 3,600 individuals come through the emergency department in the month of July. We did, I want to say, 731 surgeries in a pandemic. And by the way, we cared for more patients suffering from COVID than any other hospital in the county of Orange through the month of July. So we're fortunate. We have remarkable professionals. We have a great nursing staff, physician staff, all the care providers, from those that serve food to those that keep the hallways clean. We just keep putting one foot in front of the other each and every day.
That's all any of us can do right now, but that's great
Amen.
news.
Yes.
Yeah, I know it's been a roller coaster for everyone since March. How have you adjusted? And and since you are at a good place, how do you plan on going forward?
5 months in the rearview mirror, when this all started, all I could think of was gray skies. It was raining. There was a lot of unknown, a lot of uncertainty, and we were just taking it one step at a time. And I'm thankful that I'm surrounded by some brilliant people that acted thoughtfully. From that first day, we shut everything down. This facility is 35 acres in the making, with 2 hospitals on this campus making up those 400 patient care beds. So you can get in this hospital probably 18 different ways. We shut it down to 2 entrances in the main hospital, 1 entrance in the East Patient Care Tower. We made sure everybody had adequate PPE, gloves, masks, shields, gowns, anything to clean anything and everything. And so, every day it was like a new reality. Do we have enough gloves? Do we have enough shields? Do we have enough masks? And then the community just came pouring out with love and attention, and people are just dropping off masks. They're making shields, the Cub Scouts, the Boy Scouts. We're getting gowns flown in. We have people dropping off roses for our nursing staff. We have people, I gained 10 pounds during COVID, by the way. I gotta find a way to get it off. Food almost every day was arriving. So this thing was just kind of, shaping, taking form differently each and every day. And again, the professionals in this organization just responded in a resilient, thoughtful manner that just allowed us to continue this cadence. We have a COVID unit, a non-COVID unit. When you come in the emergency department, You pivot. You go this way if you're showing symptoms. You go this way if you're not. All moms coming into the facility are tested. We want to make sure any mom who's about to give birth is tested. If you're having a surgery, we're going to allow you to partner with your surgeon to determine if you want to test, COVID test before having that procedure. Anybody showing any kind of symptoms, we're going to test, and we're going to make sure we're caring for people. So by way of all that, we have had over 1,100 COVID patients at this facility. We've done over 6,000 tests, and we've returned over 1,000 people home, made them well, got them to be with their families throughout this pandemic to date.
Meanwhile, protecting everyone here, everyone that visits here.
Amen.
And on that note, I know some people have been reluctant to seek regular medical procedures. So how is that worked here? And what are your advice to people watching this that may need that elective thing that probably shouldn't wait?
Yeah, that's a wonderful question. And as a matter of fact, my father's having major surgery tomorrow. Major spine surgery. If you're not feeling right, you're having chest pain, you're dizzy, you're feeling slurred speech, you're feeling numbness in one of your arms, call 911. If you have a medical need and you've been deferring care because of COVID, but it's jeopardizing your health, it's jeopardizing how you're feeling, it's jeopardizing your ability to have a normal life, get medical help. We realize these are scary times, but the hospitals throughout the county, us being one of them, have done a lot of work to ensure tremendous safety and proper care so that there's a very low risk of chance you're going to get anything coming into any one of our hospitals in the County of Orange. For us in particular, like I mentioned, we did 731 surgical cases in the month of July. So we want to make sure, doctor, patient, you want to test before your procedure, we'll do that. We'll make sure you're clear. Come on in. We'll make sure once you get here, you're safe. You'll be in what we call a safe zone. The emergency department, if you're not feeling well and you don't need to call 911, but you need to get in here, go online, book an appointment through our InQuicker. You can literally click. 11:30 works good for me. I can go to the emergency department. We're going to bring you on in. You can pivot to the left, pivot to the right. If you're showing symptoms of COVID, you're going to go this way. If you're not, you're going to go that way. We're working really hard to restore the confidence of our community in all the hospitals, but especially Fountain Valley Regional. Because honestly, it's the best one.
You're not prejudiced.
Just
That's good to hear.
I love this place. And I love our care professionals.
That's great.
We want to make sure that as we're facing the community, they know we're doing everything to keep people safe, keep people well.
That sounds great. And it sounds like very good planning. Congratulations.
A lot of smart people working very long and hard hours to come to these conclusions and to these medical practices.
So let's talk about your recent award. And congratulations again.
I'm so proud of the team. And it would be my honor actually to have those professionals who actually did the work to talk about our award, if that's okay with you,
That's
Mayor
perfect.
Brothers.
So I want to introduce to you Denise Flaws, who is the director of the emergency department, and Amy Lewis is the manager of the emergency department. So let's talk about your ENA Lantern Award. I think that's a new term. It is for me, and I think it is for most people.
First of all, Mayor Brothers, thank you for including us on your weekly Mayor's Update series. We are very proud that you are here at the hospital and help us recognizing our nurses and receiving this award. The Emergency Nursing Association recognizes performance and accomplishments of emergency departments on an annual basis. This year, 25 emergency departments were recognized, including 2 international emergency departments.
Terrific. So I know you're proud of your accomplishment, and Fountain Valley is very proud of you. So how are you going to celebrate this in this strange time?
Yeah,
That's going to be a little perplexing. We hope to celebrate the end of September, the beginning of October. We're hoping to have an outdoor celebration, possibly a bonfire. It's been mentioned by employees. We kind of take everything to our staff and include them, to get their engagement on things. So they had mentioned wanting a bonfire, an outdoor type picnic.
Taco truck.
Yeah.
Taco truck.
In a taco truck, right. But unfortunately right now, if any gathering larger than 50 people is not allowed per governor's orders. So unless that gets lifted, we'll have to probably wait till spring. But they know every day we'll make sure that, they understand that this ward has not been one without their everyday efforts and anything and everything that they put into our department. We have a great staff.
So if you can briefly tell me a little bit about the criteria for this award. What did they recognize in Fountain Valley that you're doing special?
They recognize that an emergency department cannot achieve these accomplishments without the support of the hospital. So it's not just the emergency department nurses or physicians who can make such accomplishments with evidence-based practice and in leadership and innovation and research. One of the improvements that we implemented over the past 2 years was placing a registered nurse, so you have a competent clinician who is that first person that anyone who comes into the ED sees. So you walk into the emergency department, the very first person that you see is a registered nurse, and an expert clinician who can identify any emergency that walks in of all ages.
Okay, well that sounds like a good idea. So do you see these plans that you've made and these things that you've implemented, do you see them going forward?
We continue to perform according to what the standards are that the ENA sets. Best practices in order to achieve optimal patient outcomes.
Well, I suppose when you have a potential positive COVID person walking through the door, it's a good idea to be met with somebody who might recognize symptoms and know how to handle it quickly and efficiently.
Yeah. As Ken stated before, these patients are immediately separated. So if you have every patient who comes in is screened for any of the COVID symptoms that the CDC has established. And those patients are immediately separated from anyone who doesn't have symptoms in order to keep everybody safe.
And so a brief look at what some of the symptoms are might be obviously raised temperature, but what else do you look for?
Shortness of breath, cough, that's sustained more than, just your regular type of allergy cough, a cough that's getting deeper into your chest, that's more than, just a cough a day, it's, something that's consistent. Diarrhea and abdominal symptoms are now on the list. Rashes actually have become a problem. But, there's actually a bigger list that grows every day, it seems like. But cough, fever, shortness of breath are our three main points.
And if you come in with any of those symptoms, it will be recognized immediately and you would be separated from.
Correct, because we have that registered nurse. That's the first face you see when you walk into our ER.
Yeah, that's terrific.
Yeah.
Terrific. Well, I want to thank you both and ask Denise and Amy, are there any final thoughts you want to leave us with?
Well, we've been talking a lot. We're a team, and we consider ourselves equals, and that's how the department works. Is we're a team. We all work together and to help treat our patients in our community. And our doors are open. They've remained open. Our staff come to work every day with a smile on their face, and they're happy to be here, and we're very proud of our team.
Yeah, I think that goes across the board. I think that's what makes our department stand out, is that we have a good retention rate. We have long-standing nurses in our department, and they know Denise and I work really hard to keep things. We fight for things for our nurses, our staff, our unit secretaries, our monitor techs, everybody is important to us. And we really value our department.
That's great. Yeah, terrific. Last week, the Orange County Board of Supervisors approved a plan authored by Supervisor Doug Chaffee and Vice Chair Andrew Doe that will allow public and private schools to utilize county-run COVID-19 testing drive-through sites at the Anaheim Convention Center and the Orange County Fairground, which is a future site, as part of their school reopening waiver application. According to the CDPH guidance, district superintendents, private school principals, or executive directors of a charter school are allowed to apply for a waiver from the local county health officer to open an elementary school for in-person instruction. This waiver is currently only for grades K through 6, even if the grade configuration at the school includes additional grades. So K through 6 would be the only ones to attend in person under this waiver. As explained in the Framework for K-12 Schools in California, school reopening plans must address 12 topics related to health and safety in a manner consistent with guidance from the Public Health Department and the local health department. One of those topics is testing, so that testing has been made available for schools who are applying for this waiver. Schools may submit a completed waiver application to TK6waiver at OCHCA.com, and that information is on your screen. Applications will be reviewed by the county health officer in consultation with CDPH. When applying for the waiver, the school district superintendent, private principal, or executive director must submit the following to the Orange County health officer: consultation with labor and parent organizations, and publication of elementary school reopening plans on their website. For information about the waiver process, please visit the CDPHS's website, and that's the California Government Program. And the Orange County Healthcare's website is also on your screen. Remember to complete the Census 2020. This census deadline has been extended to October 31st, 2020 due to this pandemic. There is only 9 questions on the long form for the Census 2020. This counts every person living in the United States and the 5 U.S. territories. The census provides critical data that lawmakers, business owners, teachers, and many others use to provide daily services, products, and support for you and your community. Every year, billions of dollars in federal funding go to hospitals, fire departments, schools, roads, and other resources based on this census data. The results of the data also determine the number of seats that each state will have in the U.S. House of Representatives. And these numbers are used to draw congressional and state legislative districts. It is important that every household complete the Census 2020 for funding in Fountain Valley, and that contact information is on your screen. So it is critical to the city of Fountain Valley and the services we provide that you complete that census form for everyone living in your house. So it's no doubt that by now you've noticed it's been extremely hot this last week, and this is expected to continue. California and the rest of the West Coast face a historic heat wave that will put pressure on the energy grid. Along with the wildfires they are experiencing, the electricity grid is under attack. In order to avoid electricity shortages, California is asking businesses and residents to reduce your energy use in order to prevent service interruptions. It's most important to limit energy usage from 3 p.m. to 10 p.m., especially your air conditioning, your electric car charging, and other energy-intensive technology. Wait and do those later at night or earlier in the morning when there is less risk of overburdening the system. Cool your home overnight and in the morning, then close up your house and cover your windows in order to stay cool all day. On your screen, there are 3 things you can do to help prevent power outages during this heat wave. Pre-cool your home to 72 degrees overnight, and in the morning, turn your air conditioning to 78 or higher from 3 p.m. to 10 p.m. and avoid major appliance use from 3 to 10. That's all I needed to avoid doing my laundry in the middle of the day or early evening. You need to work to take care of that late at night or earlier in the morning when the electricity use is less. You can sign up to receive Flex Alert notifications from your utility provider to help California conserve energy during times of grid stress. And that information is on your screen, and they will notify you when these alerts are called. The California Independent System Operator, or CAISO, has declared a warning for the California grid and may call for rotating outages between noon and midnight today and in the future when the temperatures remain high due to excess demand for electricity. Rotating outages will begin if the CAISO reaches a stage 3 emergency, most likely during peak hours from 5 p.m. to 8 p.m. So get that book you've been waiting to read set aside in case you lose your internet and television during these power outages. The power will return, and these CAISO rotating outages typically last about 1 hour. SCE is requesting customers to reduce energy use to avoid these rotating outages. Additional information is available on the website on your screen or by calling their 800 number. That's our update for August 18th. So remember, when you're out, wear a mask, wash your hands often, stay 6 feet apart when you're out in public, and stay cool, stay calm, stay well. Until next time.